the fast way for analysis or interpret arterial blood gases. An arterial blood gases test is a blood test. It measures the acid-base balance, or pH, and the levels of oxygen and carbon dioxide in the blood. Indications for ABG sampling include the following identification of respiratory, metabolic, and mixed acid-base disorders. Location of blood sampling arterial blood gases at artery. Radialis, ulnaris, dorsalis pedis, and femoralis. First, remember the normal ABG values. There are many parameters for assessing ABG, but just remember 3 points: pH value 7.35 to 7.45, PCO to 45 to 35, especially PCO to must be memorized backwards, HCO 322 to 6. Remember, HCO3 indicates metabolism and PCO2 indicates respiratory. The second step, create a column-like grid SOS. Example: the result of the ABG examination. With chest trauma patient in WSD install showed pH 7.11, PCO to 55, and HCO 322. The interpretations of the ABG results was: pH 7.11 at acidosis column, PCO to 55 at acidosis column, and HCO 322 at normal column. Because PCO2 is in one vertical column with pH and PCO to values indicates respiratory, so it's called respiratory acidosis. Third, determine the level of compensation. If the pH is normal, then the interpretation is fully compensated. If pH, PCO2, and HCO3 values are abnormal, they are partially compensated. If PCO2 or HCO3 is normal and pH is abnormal, then it's not compensated. Because in this case of the previous questions, the pH value is abnormal, the PCO2 is also abnormal, and the HCO3 value is normal, then the compensation level is not compensated. So, you can conclude the interpretation of ABG, uncompensed respiratory acidosis. So, what if the pH values is normal? Example, pH values 7.36, PCO to values 40, then HCO 320. Then put the pH 7.36 in normal column, then PCO to in normal column, and PCO to 40 in acidosis column. Because the ACOD base value is seen from the pH value, if the pH is normal, see whether it tends to approach acidosis or alkalosis. In the above case, the pH value tends to approach acidosis, and one column in acidosis is HCO3 value, so it's called metabolic acidosis. Because the pH value is normal, it's 7.36, we call this case fully compensated metabolic acidosis.